Info for patient.
Assalamu alaikum, sir.
Assalamu alaikum.
Sir, please introduce yourself.
So my name is Rui Xavier and I am an otolaryngologist from Portugal. My main activity is rhinoplasty, so that's what I really enjoy doing, so that's why my focus is in rhinoplasty. And I came here to this great congress that I should say to share my experience in rhinoplasty.
Sir, how do you feel here in Pakistan? What is the difference regarding medical here and in your own country?
Many differences, I would say, but the one thing that probably we have in common, Portugal, my country, Portugal and Pakistan, at least from what I have sensed in the few days that I have passed here, is that both Portuguese people and Pakistanis people are very friendly. Yes. And that is something, that's one of the good memories that I will take from Pakistan, is how friendly the people are here.
Sir, how do you select the ENT surgery? How do you come in this domain? Yes.
Well, that's a good question. So I wanted a specialty which was specific in one area of the body. So I wanted a specialty that would be specific in one part of the body. So ENT was one of those specialties. So we do the diagnosis, we do medical treatment, we do surgical treatment, we follow the patients. So that was what I want. So I did not want a specialty that I would make the diagnosis, but then another colleague would do the treatment, or that I would do treatment, but another colleague would do the diagnosis. So I would want something that could embrace all the stages of the medical activity, let's say. Of course, with support of other specialties, of course, but in that particular field, we can deal with everything. And then ENT is also interesting because it deals with different things, with the ear, with the nose, with the throat, and in fact, even though these areas are interligated, and even though we might find, for instance, ear disease, which in fact are related to problems in the nose, and we have to correct the nose several times, or we have to address the nose in order to improve the ear. That's a fact, it happens, but those are really different things with different ways to treat, with different surgical treatments. So I find it quite interesting. So even though many years have passed since I did my choice of becoming an ENT specialist, I think that I did the right choice, and I do not regret not having chosen a different specialty.
Sir, what do you think? What is a Rhinocon?
Rhinocon?
Yes.
So I first learned about the Rhinocon a few months ago when I was invited to come here. So I thought, and I know that this is a congress about the nose, so both in the functional component of the nose, in the aesthetic component of the nose, in sinus surgery, which I think makes all the sense, because so amongst all the fields of otolaryngology, the nose is my favorite one. And even though nowadays I almost only do rhinoplasties, I've always liked sinus surgery. I've always liked the functional part of the nose. And so I think that one congress that mix the functional part, the aesthetic part, and the sinus disease makes all the sense. And it's not so common that we find congresses like this. So I think it makes all the sense.
What is the best domain for rhinoplasty, ENT or plastic surgery?
I usually say that the rhinoplasty should be done by someone who knows how to do a rhinoplasty. So it doesn't matter, in my mind, it doesn't matter if this surgeon has a background in ENT, or if he or she has a background in plastic surgery, or even in maxillofacial surgery. I think it doesn't matter. As long as the surgeon is committed to rhinoplasty, is committed to studying, to learning rhinoplasty, I think that the background does not matter, because if you are a plastic surgeon doing rhinoplasty, you'll have to learn things that are mostly related to the otolaryngology, particularly the nasal septum, the functional part. If, on the other hand, if you have an ENT background, you probably also have to learn things that are traditionally related to plastic surgery. So I think that it doesn't really matter the background that you have. What does matter is the commitment that you are willing to put in rhinoplasty.
Sir, what is your message for the young ENT surgeons?
So my message for young ENT surgeons, this is a tremendous specialty, this is a beautiful specialty, and if you want a specialty that can be a challenge, that can be at the same time quite rewarding, I think that ENT is one of such specialties. And of course, it takes hard work, probably as in every other specialty, it takes hard work, it takes commitment, particularly if you are dedicated to rhinoplasty. They say that the rhinoplasty surgeon is the eternal student, so it means that you always have to study, you always have to improve your results, because it's by no means an easy surgery, so every case is a different case, every case is a challenge. If we have really a devastated nose, of course it will be difficult to restore it, but if we have a nose which is not so bad, but we just want a refinement, it is also a challenge, because the expectation in what concerns the result for such a case is really high. So there are no easy cases in rhinoplasty. Each case is a challenge, each case is difficult on its own way. So, but it takes commitment, it takes really being willing to spend time in congresses like this, studying, presenting your own experience, learning from other people's experience. In the end, you will be improving your skills.
Sir, your message for the ENT patients?
For the ENT patients, well, I think that you can trust the ENT doctors, because from what I've seen here, for instance, ENT doctors are really willing to come to these congresses to learn. We have seen that the lecture hall was crowded. It is 6 in the afternoon, so we have just finished our session, and there were so many people here. So I think that if the ENT doctors are willing to spend one entire day here, one Saturday here, to improve their skills, so the patients should trust their doctors.
Please conclude all this talk in your own native language.
Foi gosto estar aqui e vou levar muito boas recordações do Paquistão, sem dúvida. E espero voltar. So what I just said, translating, is that I will take very good memories from here, and that I hope to come back.
Thank you very much, sir.